Welcome back to How to Hyperbaric podcast. I'm your host, Dr. Masha, and today's episode is really special. My guest today is Dr. Jason Saunders, whom I deeply respect and whose recent PhD research might reshape how we see longevity, anti-aging, and hyperbaric's role in it. So, in this episode, for the first time, Dr. Saunders will share his findings on hyperbaric therapy and anti-aging using two different pressure settings, 1.3 ATA and 2 ATA. We'll talk about the differences between the effects of 1.3 and 2 ATA on longevity and anti-aging and inflammation. We'll also talk about the unique benefits that mild pressure might bring and the whole role of hyperbarics in longevity. We'll also discuss why taking breaks in hyperbaric therapy might actually make this therapy more effective. So by the end of this episode, you'll have a very clear perspective on which pressures do what in terms of longevity and anti-aging, and where this whole anti-aging hyperbaric therapy biohacking field is heading. Welcome to the show, Dr. Saunders. I'm excited to have you with us today.
Happy to be here and looking forward to being able to share some of these results for sure.
First of all, congratulations on completing your PhD from myself, from my family, and from all our listeners and viewers, because Jason, you and I share a lot of people in our audiences. So we'd like to congratulate you. And we also want to thank you because this information is what community really needed. Let's dive in right away. My first question: what was, in your opinion, the most important finding from the research that you did?
There's a lot. So, quite honestly, independent of the actual findings, here's what I think was the most important. This has been a conversation, as you well know, in the industry for 20 years minimum, probably longer. Is 1.3 atmospheres enough? Does it do anything? I heard it doesn't do anything at all. Is higher pressure dangerous? I heard oxygen toxicity. I heard this. Like we hear about the things that are either being said by other industry leaders or just rumors throughout the industry in general. And rather than answering a lot of these questions just like emotionally or what my opinion may be based on just some experience I have clinically, which is still valid, somebody needs, and not that this is the only version of this story, we need more research projects like this. But, a few of my mentors early into this project, they said to me this, they said, listen, just so you know, you're opening a can of worms here. And it's possible that you find out that 1.3 doesn't do anything. And I said, that would be terrific because right now there are a ton of people out there that are claiming that 1.3 has all these different benefits. And if it doesn't, we need to clarify that for the sake of the industry. If it turns out that 1.3 does do something, well, then that's terrific because there's a lot of people in the industry that say that it doesn't. And so we need some data to set the record straight so that we can have not an emotional conversation about our feelings of equipment or pressure, but a data-driven conversation of like, do these things actually have physiological impact or not? And if they do, where are their limitations so that we can move this industry forward in a direction? And quite honestly, I think that's the most important thing was answering a question like that. And again, I would say like any research, any good research, I have more questions than I have answers at the end of this, but we certainly saw impact on both sides of that equation, and we found some really incredibly surprising, data points as well, which I'm sure you and I will cover.
So you came to the whole thing from a non-biased perspective. And this is what I like about you. This is what makes a true scientist,
Right.
because we all could have come to this saying, okay, I just really want to see that 1.3 does something, or that's equivalent, or that it has its benefits. But you rather approached it from a non biased, let's just see what is there truly so we can help other people achieve their health goals. What was
Right.
the most surprising finding for you?
I think, and I think you would agree with this, but a lot of people in the industry, if they're in favor at all of lower pressure, would say something like, I think in a lot of cases, not every case, but I think in a lot of cases, where we lack pressure, maybe we can make up for that with time. And so in some cases, maybe, if we're using mild pressures if we increased frequency and duration, perhaps we can get similar, maybe the same, but certainly maybe similar results. And so, people in the lower pressure world have always manipulated time where pressure has been limited and have felt like, hey, I think this is reasonable to get to certain degrees. And we certainly found something like that. I think a lot of other people in the industry would say, even if you did get to a similar place, higher pressure, probably gets people to a certain degree of improvement or changes faster, which is another thing we saw in some of the areas. But I think they would have also said, I think that higher pressure is capable of doing certain things that low pressure could never do, no matter how much time went by. We also saw that. But what we also found, which nobody expected, including myself, was that there were also other instances where lower pressure did things that higher pressure did not. And that really starts like a whole different understanding of potentially different pressures for different goals. I've always said, part of the problem in our industry is that we use the single term to describe a huge range of therapy. So hyperbarics is, from lower pressure to higher pressure. So from, let's just say 1.3 to 3 atmospheres, it's a huge range. And from 21% oxygen all the way up to 100% oxygen, that's a huge range. And our job isn't to say everybody should get the most that my equipment is capable of. Our job should be to understand what the goals are and learn how to develop protocols that best match the tissue type, the severity, the acuteness. How do we take this big range of oxygen, this big range of pressure, and apply it in a meaningful way so that the right tissues are getting the right pressures and the right percentages of oxygen over the right periods of time? That's where I think this industry needs to go. This study did not answer all of those questions, but certainly it opened a dialogue to start to answer a lot more of those questions. But the fact that the lower pressure had impact that higher pressure didn't, that was very eye-opening, not just for me, but even my entire committee or people I've shared that with so far, et cetera.
So you mentioned several things. One is that in some instances, time can make up for lower pressure. Can we dissect that? Can you maybe talk a little more about that and explain what you meant? What do some instances mean and to what extent, to what degree, maybe?
Maybe you want to talk about like research design, just so I can sort of share some of that thought, right? So, you know, a couple things that made this particular study unique. One is that this was a head-to-head study. Everybody went through, basically there was 2 treatment groups, a 1.3 treatment group and a 2.0 treatment group. And then there was a control group. The control group didn't get treated at all in that same time window. They just got monitored with testing. When the study was over, the control group was randomized. This whole thing was double blind. And so the control group was randomized, and half of the control group went into the low pressure and half of the control group went into the high pressure. And they went through the exact same initial protocol to see also, one, to get a number, more people going through the protocol, two, to start, almost replicating the data in real time. Okay. So this is called a crossover study. They did 3 days a week, and they did for 3 days a week for 5 weeks. We took a 4-week break, and then we did 3 days a week for 5 weeks. We tested everybody before we started. We tested everybody after the first 5 weeks of treatment. We tested everybody after the second 5 weeks of treatment. And then we tested everybody 4 weeks after the treatments were ending. We looked at a cytokine panel, which is basically, let's just say, like predominantly like an immune-based inflammatory panel, 71 different markers. We did a computerized cognitive assessment looking at executive function, reflexes, memory, information processing speed, motor skills, things like this. And then we did a whole epigenetic panel looking at biological age, as well as a number of different um, methylated locations inside the epigenome, all of which are correlated with either different changes of improved health or even decreased health, or are associated with maybe certain disease processes, et cetera. And so, it looked at, I think, about 900,000 epigenetic methylated locations inside the epigenome. And then it also measured some other, like, they're called MRSs, but methylation risk score. But essentially, areas of the body inside the epigenome that are heavily correlated with disease, and then what changes the intervention may or may not have had on those locations. So that's really what we were looking at. And so, um, I'll use the inflammatory panel as an example. So we looked at 71 different markers of inflammation. The low pressure group had 21 markers that were statistically significant. The high pressure group had 20 markers that were statistically significant. They had about 8 markers that they shared. In other words, from the group of 21 and 20, about 8 of them were similar in the low pressure and the high pressure group, but the order of magnitude was higher in the high pressure group. So they were statistically significant in both groups, but the higher pressure group had a higher impact faster, which is kind of what I was referring to earlier as I was describing, right? If we stick with the low pressure long enough, it'll climb and be impactful, but the higher pressure group had that impact sooner. At the same
I'm
Yep.
sorry, I'll interrupt just for our listeners. When
Right.
you refer to cytokines and inflammation markers, you're referring to things like interleukin 6, tumor necrosis factor alpha. These were the markers that you measured. And some of these markers, our listeners can actually measure if they do a blood test, right? So they
Correct.
can maybe
These
rep
are
some of the.
these were a mix of standard and I'd say less standard immune markers, but a lot of them, like all the interleukins and tumor necrosis factors, those are all testable in not standard lab tests, but pretty similar to a standard lab.
And
Cytokine testing is definitely an option.
Yeah, before you continue, why is these inflammation markers are even important? Why are we testing those inflammation markers? Because when we look at biological aging, when we look at the disease prevention, longevity, health span, and things like that.
So, and I'm sure you would agree, but if in 20 years of practice with patients, to me, it's never been about treating the illness. It's always been about the illness is just the expression of a consequence, a long-term consequence that's built up over years. And I'm always looking for patterns and I'm always looking for common denominators. Because if there's a single common denominator that potentially is associated with 5 or 6 different diseases or 5 or 6 different symptoms inside of one disease, I don't want to treat the symptoms. I want to treat the root and I want to get to that common denominator to allow for an expression of health. And so I'd say 2 of the most powerful common denominators amongst all chronic illness, neurodegenerative, autoimmune, cancer, heart disease, all of these different diseases are chronic and systemic inflammation and mitochondrial dysfunction. So the energy system isn't strong enough to produce energy at the level that we need to continue to deal with and perform on a cellular level and deal with the changes and the toxicity and the adversity of living on planet Earth. And then this sort of chronically elevated level of inflammation. Real quick, just to point out, all of the subjects in my study were asymptomatic and non-diagnosed. And I did that on purpose. I wasn't trying to say hyperbaric is the treatment for cancer or hyperbaric is a treatment for neurodegenerative disease. I said, I believe that even an asymptomatic, non-diagnosed, healthy American, although I would say this, is across the world, is still more inflamed than they should be, is still lower energy than they should be, is still showing early signs of cognitive decline well before there might be a diagnosis. And so I wanted to see, can we lower inflammation, improve cognitive performance, improve mitochondrial function, reverse biological age in otherwise healthy individuals? And, again, the moral of the story was yes, and in both cases, differently, but in both cases. So let's just say I'll average it out and say 20 cytokines that were important, these inflammatory markers. Lowering inflammation across the board would be important for disease prevention, but also longevity, because again, chronic inflammation is associated with, the accumulation of chronic illness over time. So about 8 of them were shared, so similar between the low pressure and the high pressure group. Then there were a number of cytokines that high pressure impacted that low pressure didn't, or at least it wasn't statistically significant. So, again, back to that narrative, high pressure might do certain things that low pressure just can't. I would say that that was true. But also, there were a number of cytokines that were statistically significant in the low pressure that weren't statistically significant in the high pressure, which opened up this conversation of, wait a minute, low pressure is also doing something unique and something that high pressure isn't. It's not like every time you go up in pressure, you get whatever the benefit of the lower pressure was plus whatever the higher pressure is doing. It was very unique in that, you know, especially things like, and these are important for most, pretty common autoimmune diseases or even many cancers, interleukin 6, TNF alpha, TNF beta, those were statistically significant in the low pressure group, but not statistically significant in the high pressure group. And that opens a whole new understanding of, wait a minute, maybe there is room to either use different pressures on different people over periods of time, or do some testing prior to even starting, understand what's going on in this person, and actually build protocols based on what type of impact we're trying to have. And that's really where I think the most exciting version of that story is going to end up going.
I just want to add to that again for our listeners, just to give their sort of the context. Now, with those cytokines and those inflammatory markers, some diseases would have certain markers elevated, and other diseases would have other markers elevated. Therefore, if we know the diagnosis and we can test beforehand which inflammatory markers are elevated, maybe, hopefully, and yes, we will in the future, match this to the pressure and oxygen concentration to make sure that we're targeting specific markers. So hyperbarics becomes a very targeted therapy in that regard. And that's why those findings are really a breakthrough, and that opens a door to a very different future of hyperbarics than what we initially maybe thought several years ago.
People ask me these questions. I don't have the answer. We need the studies to show. But like maybe 1.5 does hit all of them, or 1.7 does hit all of them. I don't know is the answer right now. But right now we can say lower pressures had a certain effect, higher pressures had a certain effect. And yes, maybe there's something we can do to initiate an understanding and develop a protocol accordingly.
This is very exciting, which means, as you said at the end, you probably had more questions than you did at the beginning, but those are different questions. It's not like your questions weren't answered. It just
Right.
opened a
New
door,
question. Totally.
new questions and then new questions. And this is the how we keep progressing as a society, as a community, as humankind, and how medicine gets such an exciting field. You also mentioned that among different measurements, you used methylation clocks. And methylation clocks is a measurement for a biological aging, which, in my opinion, is probably more superior than telomere length, or that it gives us more information than just the telomere length. Those methylation clocks, at least last time that I checked, the testing is not as widely available as, for example, telomere length, which now you can do pretty precise testings. But these methylation clocks are probably the future of biological aging testing. And can you share with us the findings of different pressures, how they affected those methylation clocks,
Sure.
therefore our age and
Yeah.
for how we
And I
age?
think to your point, to me, it's like the more information we can collect, and these clocks are essentially algorithms that we can plug in and each clock has a slightly different skew on the algorithm. And so I can't say at this time that I feel any singular clock is like the answer. Certainly, looking and running data through a number of different clocks and getting some averages, I think would probably be the best way to utilize some of this in the near future. And or as we learn more, I think these algorithms will continue to change. What I could say, which is interesting, let's just say for now, there's also a category where a number of these tests are considered like generation one biological aging clocks, and then generation two. And there's a number of tests in each one of those two categories. We ran, I think, essentially about 8 different biological ages, about 4 in generation one and about 4 in generation two. In the generation one clocks, what we saw was even in the first 25 hours of treatment, the mild pressure group already had biological age reversing. And by the time we finished, the second round of treatment, there was addition, so that trending just kept going in the same direction. Um, in the first 25 hours inside of the generation one clocks, the high pressure group did not have a reversal of biological age. They actually had an acceleration of biological age, which was very counterintuitive and super surprising for me. Um, my assumption right now, and I have some work yet to do, but my assumption is that I think generation one clocks are weighting oxidative stress pretty highly. And so certainly the high pressure group was exposed to a higher degree of oxidation. And that might just be weighted heavily enough inside some of those algorithms that is where the reversal or the accelerated aging process maybe showed up in the higher pressure group. By the time the treatment was finished, the high pressure group was no longer in an accelerated aging, and it started to show biological reversal. On the generation two clocks, we didn't see any impact in the low pressure group, or not statistically significant. We did see statistically significant biological reversing, but not during the treatment. That didn't show up until the break. So a very statistically significant impact reversing biological age in the high pressure group showed up once we stopped treatment and measured again 4 weeks later. And that was interesting to me, but also another reminder of why the breaks are so important. We have to give the body a chance to repair, recover, and to some degree catch up with all of the work that it's been doing by being exposed to this tool repetitively for weeks on end, right? So these guys got, 3 times a week for 5 weeks, a break, 3 times a week for 5 weeks, and then a break. It was that second break where we really saw a statistical reversal of biological age in that group. And I think it was the break that brought it out. So again, that was just a reminder to me, even as I'm teaching these courses, that strategic breaks in care, more is not better from a pressure standpoint. I believe it's creating the right protocol, the right pressure, et cetera, duration, but also that strategic breaks are necessary for really extracting the full benefit of the treatment.
It almost feels like the body needs time to sort of stop. You know how when dogs get out of water, they pause for a second, then they have to do
Yeah.
this. Yes, and then they continue with their life. It's almost like mitochondria needs to do the same thing. It needs to pause for a second, then do this, and then wait a sec. I can actually
Right. Every therapy that we do, hyperbaric or other, I'll say there's benefits and consequences, even if the consequence is just like exercise, right? You're breaking down muscle tissue with exercise on purpose because in your breaks, in the rest and recovery, you're growing, healing, and becoming stronger and faster as a result of that damage. To some degree, all of these therapies, if they're in the hormetic stress of a therapy, which all of these are, there has to be some type of stimuli that creates the healing response, and we have to create windows of time to allow that healing to occur. I think that's, critically important.
Excellent. I will ask you questions about breaks, but at the end of this
Sure.
podcast. So, guys, please stay tuned if you want to know and learn from Jason how long these breaks should be, who should take them, when to take them. We'll talk about it. But first, I still want to sort of continue the conversation of longevity and hyperbarics. So, what place do you think hyperbaric therapy has? What role does it play in this whole longevity thing, prolonging life and also having healthy life, so
Right.
extending health span?
Anytime I do a lecture on this, not that we'll go into all those details, but we always want to get on that same page. Like, there are people who are afraid of hyper extended longevity if that doesn't come with high level of quality, and rightly so. Nobody wants to live to 100 but be suffering for the last 30 years of their life. So the first thing that has to happen is we have to continue to develop health span inside of the current, you know, longevity limits. And then I think it's responsible to say, now that we've understood that and we're successful in that, because even right now, you know, lifespan is roughly, let's say low to mid 80s on average, but health span is still low to mid 60s on average. So even today, most people have about a 20-year, 15 to 20-year span of significantly declined quality of life for their last handful of years. And so nobody wants that. Everybody wants, however many years we get, we all want them to be as high quality as possible. So we have to first close that gap and push health span to at least match current lifespan averages. And then we can get creative and push health and lifespan together as far as we want, right? I would just say that oxygen, in a lot of ways, oxygen plays a role in both of those, not because, again, not because it's the treatment of disease, not because it cures anything, but because oxygen does two very specific and important, or it stimulates two different pathways inside of our body. Really a lot more than that, but if I can summarize it into two. The first is as a fuel, as part of the fuel system. So the same way our cars mix fuel and oxygen, and that oxidizes the fuel to create power in the engine of our cars, our mitochondria, which are the engine in our cells, utilize fuel and oxygen, oxidize the fuel, and use that to create cellular energy, cellular power. And we know that with age and age-related disease, our ability to have healthy mitochondria providing us with enough energy for even just normal demand seems to diminish. So if there's a way to improve the efficiency of mitochondrial energy production and or a way to actually increase the size and number of mitochondria that we have, we can have an incredible impact on the energy production system. And we know that hyperbaric does all of that. So that's one pathway. The other pathway is all about healing and regeneration of cells and tissues. And we see that through, what, let's say, especially, let's say the Shai Efrati and Amir Hadani discuss this hyperoxic hypoxic paradox, where we're saying this roller coaster of increased and decreased oxygen exposure. We're getting the benefits of hyperoxia. And a lot of that has to do with the mitochondria. But then we're also creating this relative hypoxia, which stimulates a whole series of different pathways. And through the stimulation of molecules called sirtuins, which some consider to be like longevity molecules because they're so specific with how they help us adapt to, let's say, certain environments. but also through HIF1, which is hypoxic inducible factor. So our body's ability to respond to low oxygen environments. Both of those stimulate pathways and cascades that create new blood vessel growth, collagen formation for skin, hair, and nails, stimulates stem cell mobilization and growth factors for healing of cells and tissues. So, between those two pathways, the energy production and then the healing and regeneration and repair of cells and tissues, this becomes, again, not the cure for longevity or anti-aging, but a foundational tool that's providing an ingredient that the entire body will utilize as part of the protective mechanisms from an aging and longevity standpoint.
Excellent explanation. So, after conducting this study and analyzing all the data that came with it, and I understand that there was so much data, that overwhelming amount of data, right? And it took some time to actually analyze it, categorize it, and decide what will be the basis for the paper. Now, after doing all that work, which took several years,
I'm still not finished, by the way. But yeah, exactly.
exactly, because there's so much data
Right.
and some of it has to find its way sort of into categorization and explanation. So, after doing all of that and taking into account the anti aging hyperbaric protocol as we know it after the study that was done by Shai Fradi, yeah, you just mentioned the guys in Israel who did the study when they looked at the telomere length and the number of senescent cells and concluded that hyperbarics was beneficial and it did reverse biological age. They did a certain protocol, which was 2 atmospheres of pressure, 90-minute sessions, I think 60 sessions was it, and so on. In comparing to the protocol that you did, which is a different protocol, you also did it on 2 different sets of pressures, which makes it different from the previous study, right? So,
Right.
with the previous study, let me maybe go into a little more explanation. I think the biggest challenge people have is that the study was done at higher pressure. Not everyone has access to hyperbaric chambers that go to 280. So, an overwhelming amount of questions that I'm getting, what if I have a 1.3 chamber or 1.5 or a chamber that goes to 1.7? Can I still get anti aging benefits out of it? And what to do with all of that, considering that we also depend on the equipment and not only on our understanding how things work, but if I only have access to this type of chamber, there's only so much that I can do. So, what do you think of all of that?
There's a lot in there. So,
Hmm.
a few ways to approach that. One would be to say, in general, if you're not replicating the exact same process, you can't say you're having the same impact. In other words, if that was done at 2 atmospheres, 90-minute sessions, 5 days a week for 60 sessions, and someone's doing 1.5, even if it was the same protocol but a different pressure, or let's say they doubled the frequency and duration because they're having the pressure, you still can't say that, like, that that's going to have the same impact. You can't until those studies are done, right? And that was, and to your point earlier, telomeres and senescent cells are critically important to understand the impact, let's say, this tool is having on people. But that's not the full story in terms of like aging or longevity. That's a part of the story. I think a lot of this methylation information is as important. Quite honestly, I think it's more important than telomeres alone or senescent cells. But all of it mixed together is really what tells us the largest amount of the story. As an example, in the study that I did, and we measured in a different way than they measured telomeres when they did that study. This is the company that we used has another algorithm so it's not a direct telomere measurement, but it's an algorithm that allows for an associated telomere change. In the lower pressure group, we missed statistical significance by 0.01. So In order to be statistically significant, the p-value would have to be 0.05 or less. For the most of the audience, that doesn't necessarily matter, but our number was 0.06. So like essentially we missed we had telomere lengthening. We missed statistical significance of telomere lengthening by like a fraction. We were also only doing 3 days a week, right? So if we did 5 days a week, would we have hit that? Or if I did another 10 or 20 sessions after that, would we have hit it? The answer is nobody knows because we didn't do it, but it's likely that we would have had telomere lengthening and be statistically significant, even at low pressure. Was it the same lengthening, like amount? No. But again, that might be where time plays some role. Again, we can't say that with definitive answer, but we can say that that's a possibility. So did we see biological age reversing in the low pressure group over the course of 50 hours on certain clocks over a certain period of time? Yes. Did we see biological age reversal in the high pressure group on different clocks over a different period of time? But yes. So essentially, we saw signals that are associated with significant biological aging anywhere from, the low end 1.3 through the high end. We just saw it in different places over different periods of time. So can we associate these lower or different pressures with this process? I think the answer 100% is yes. If you asked me why, the reason would be because I was saying earlier that there are certain hallmarks of aging, like lowered stem cell response, like lower cellular energy production, like chronic elevated inflammation over long periods of time, like toxicity buildup over time, right? Cognitive decline. So if hyperbaric at any one of these pressures lowers inflammation, which we know that it does, if hyperbaric at any one of these pressures improves cognitive performance and memory, which we can say that it does, if hyperbaric at any one of these pressures stimulates growth factors and repair factors, which we can now say definitely does, and if we can say that either one of these pressures can start showing telomere growth or statistical significance of telomere growth, we're pretty close to saying that that's also true. If we can say that it's improving mitochondrial function and cellular energy, which we can say in both pressures is true, then of course, in both pressures, we are going to have a measurable and significant biological age reversal. It may show up differently. It may show up over different periods of time, but certainly we should be able to say that that's an expected response almost regardless of which pressure you're using. Now, I'm going to pause there and just add a totally different comment. When we do research, I did, essentially 50 hours. The telomere study did 60 hours. A lot of research does 40 hours. What happens at the end of that session or that protocol? In other words, if you did 60 hours over the course of 3 months, and then you got 20% increase in telomere length of certain cells, and then you never go back into a chamber ever again, what's the long impact of that? Nobody knows. Versus, let's just say you got 4% increase in telomere length, but you made that a part of your lifestyle for the next 30 years. What's the impact of that? It's a much smaller impact, but over a longer period of time, maybe it's the same impact. Maybe it's a greater impact. We don't have the data to support either one of those yet, but just in thinking it through, this ought not be something that you do for a couple months and never do again. As you and I think would both agree, this is something you would do for specific reasons, and you might do periodically throughout your life so that you're extracting these benefits over a long period of time, not over a short few month window.
And to make things more complicated, let me add to that. What if you do this on the basis of changing your lifestyle? We know those telomere increases don't only happen in a hyperbaric chamber. We know that reducing total calorie intake will result in longer telomeres. We know that certain changes to the lifestyle, maybe they're incremental, maybe they're not as big as you would get in a hyperbaric chamber, but it all adds up. And I'm a big believer that healthy lifestyle must be there first in order for all other changes to happen. So, what if we combine the two? Can we actually do okay with lower pressures?
Or even be
What
more
I
impactful by,
exactly.
like, strategically creating a synergy between a multitude of strategies and therapies that, on a cellular basis, work well together. You know,
I agree.
my my gut answer is yes. My research answer is we don't know yet, but let's hope that, the research continues to grow so that we can actually answer that.
Absolutely. What I do recommend, though, because I don't want to leave everyone without an answer, and Jason, please comment what you think about it. There biological age testing available. There are different ones. There are ones that measure telomeres. That there's one that I particularly like that measures inflammation in the body because I'm a big believer that inflammation drives the disease. Disease drives inflammation, and it's all of it is driving us, towards the end of our life. So when we decrease inflammation, we get better. With this testing, can give you an idea, guys, when you use hyperbaric and all other interventions that you might be using, where are you heading? Where are you going? How is this biological age changing depending on what you do? And you feel a little bit in control rather than I will just try this therapy and see what happens. I will try this therapy, but I will also measure biological aging and some other metrics that you can measure every day: heart rate variability, your sleep metrics, your yearly checkup will show things that you're heading in the right direction.
Yeah, absolutely. I think that, for a lot of people, and you know this having been doing hyperbarics as long as you have, the first 8 to 10 sessions, some people start to see changes quickly, but a lot of people, most people, in the first 8 to 10 sessions, they might say from a symptomatic standpoint, they're not sure anything's happening yet. Meanwhile, on a cellular level, we know that they are. But it takes time in many cases for whatever's happening and changing at a cellular level to show up systemically in a cell type, a tissue type, or, like, for the person or the organism as a whole. And so, um, having something like these tests to measure something where, I may or may not be feeling anything yet, but I'm seeing something changing on paper, well, that's incredibly helpful to understand, like, am I on the right track or not? And yeah, I think some of the short-term things that would change, people can catch on wearables, like heart rate variability, sleep quality, the amount of REM or the amount of deep sleep somebody gets, general stress levels and things like that. Like, those are things that people could monitor pretty quickly. And then the next layer would be, like you said, I think changes in, systemic inflammation. Um, that also might show up as changes in range of motion for somebody. So if you're with, hands-on with patients and measuring range of motion, as inflammation goes down, range of motion will go up. They might not notice it because, like, it hurts when I bend my elbow, right? Well, it used to hurt here, now it hurts here. That's a big difference, but it still hurts when I bend my elbow. You understand? So the the response you get from a patient might still just be, "It hurts when I bend my elbow," but if you're measuring something around that, like range of motion, you could start to see where you're having impact before other people realize what's happening in their body.
And before we get to breaks, because I promised everyone that we'll talk about breaks, I think it's super important as getting into a chamber, is taking breaks. I have a personal question that I wanted to ask you because I have this luxury, I have this hour with you where I can pick your brain and ask all these questions. We sort of starting to understand differences between 1.3 ATA and 2.0, but there are different pressures between 1.3 and 2.0, in particularly 1.5. And I will share with you what I'm seeing clinically. So, just in clients and people who do 1.5 as their main sort of pressure, I see that changes are happening a little faster than in 1.3. I don't see the increased amount of oxidative stress as I would in somebody who's doing 2.0, for example. But it also depends largely on the person, so I wouldn't even comment there. Oxidative stress in an 18-year-old athlete will show differently than, 85-year-old woman. So, but in your opinion, what differences have you seen? Have you used 1.3 versus 1.5 or 1.3 versus 1.7? And what are your thoughts? They don't have to be backed by science or anything
Yeah,
like that. This is more like,
just conversational,
hypothesis.
sure.
Yeah, clinical picture.
Um, in a lot of cases, especially I'd say neurological cases, like, I don't tend to go very high in a lot of those cases anyway, and I'd say a lot of the people in my office would be treated somewhere around 1.3 to 1.5, almost their entire treatment plan. Even if I could go to 3, I'm not. I'm not even going to 2 in most of those cases. So I would say that, like, especially on neurological cases, we still start at 1.3, but we try to get to 1.5, and we probably do more at 1.5 because I agree, I think I get faster results in those cases, and I'm trying to always trying to figure out what's the minimum effective dose that somebody needs to get the response as safely and quickly as we can, right? And there's a lot to juggle in that sentence, but that's the thought process that I'm going through with everybody. Um, I was talking to Dettori yesterday. We were on a long car ride together, and we were talking about a million things. We had like 2 hours and two different, round trip to talk a lot, but we were debating whether if we could only have one pressure ever, and we have to treat everybody at one pressure for the rest of our lives, what would that pressure be? And it was essentially became sort of like a dialogue of like somewhere between 1.5 and 1.7 would be like that would be, it almost seems like that range, it's not too much for most people. It's enough for a lot of the other issues. And it's kind of like the blending of both worlds on some level. But again, to your point earlier, that's just a feeling that I have. Um, I can't prove it yet.
I actually trust feelings
Yeah,
a lot
me
more
too.
than, yeah,
Me too.
because you get the information somewhere up there, you know? Thank you. Let's talk about the breaks. Thank you for all who stayed with us, who listened to. This was an incredible talk on longevity and how to incorporate hyperbaric therapy at different pressures into longevity protocols. Of course, we didn't cover it all. Um, Hopefully, I'll have Jason again to share more with us. But now let's go into breaks. This is a very important question because I think this is the biggest mistake that people make when they do hyperbaric therapy. I see people getting their hyperbarics 365 times in a year, and sometimes more because they'll fit 2 sessions a day without taking any breaks.
The other version of that I see is that by the time they take a break, the reason they're taking the break is because they're burnt out. And they're like, "Ugh, I've done enough. I don't even want to do this anymore." And so now that's a break, but it becomes like a much longer and probably a further extended break than it should have been, where they needed the break earlier from like a healing and recovery standpoint. And now this break will be longer than it should be because they're kind of burnt out. And so having strategic breaks, like purposeful breaks to allow for the recovery process, I think is the idea. Um, again, like the book that Joe and I wrote, back last November, it's like the art and the science, right? So there's a lot of research, there's a lot of science. I love the research, I love the science, but like if you're doing this for a living, you also have to be an artist. And part of the conversation around breaks, I think, fits the art side of that conversation. I don't believe in definitive protocols that are just like, this is how it is. So, if I were to simplify my thought process, here's what I would say. I would say the average person using hyperbarics for whatever they're using it for is likely going to fit a mold like this. You know, after the first 8 to 10 hours, they're kind of like, I'm just not sure if anything's happening yet. From session like 10 or 12 to like 15, they're like, I think something's happening. But they're still like cautiously optimistic. I think it's happening. I'm not sure if it has anything to do with hyperbarics. I'm not even sure that it's happening, but I'm noticing some small changes. Then from like, let's say 15 to 20 or 15 to 25, it's like, hey, whatever I thought was happening, oh, it's happening, right? Now I start to actually know that I'm tracking in a certain direction. And then from let's say 20 or 25 through 30 or 40 in many cases, there's like an exponential increase in response and in, symptom or performance-based metrics. So if that's the average person often takes a break around hour 40, which is, what we see in the research or we hear people saying all the time. But it's not because, in my mind, if we do it that way, that's not because you hit 40 and that's what that means. It means that oftentimes that same person at around session 35, 36 might start be like, I got nothing, something, a lot of improvement, and now I'm starting to plateau again. And it's in that plateau. I'm always looking to take breaks near plateaus. That's how I view it. So if that's the standard version, there are some people that start getting benefits very quickly. Sessions 2, 3, 4, it's like, oh my God, I never would have promised somebody this because this is more the exception than the rule, but I'm always happy to see it. But that person may also start to see a plateau then closer to 18 to 20 or 20 to 24. And so I'm not just like, listen, we're in a plateau. We're not seeing any changes. We're just going to push through it. I'm usually like, okay, let's take a step back. Let's take a break. That break may only be 3 or 4 weeks. Let's let the body catch up and recover, and then let's push again. On the flip side, there are those people, I'm sure some of the listeners are these people too, where like, I did 20 hours. I didn't really see much. Someone convinced me to stick around long enough to do 30. Maybe I'm seeing something, I'm not sure. And then all of a sudden, I'll do 10 more, but I don't know that I'll do any more. And it's like session 32, 34, and all of a sudden you're starting to make that turn. In those cases, I'm not taking a break at 40. I'm like, you laid all of this groundwork. We built this whole foundation. We're finally starting to make that turn. How far can we go? And I'm more likely to do another at least 5, 10, 15, maybe even 20 hours past 40, get closer to that 60-hour mark, and really ride those benefits as long as I can before we start to see another plateau. There's probably 20 iterations of people in between those 3 categories, but just as like a thought process, that's how I teach it. That's how I think about it, and then I may apply things slightly differently based on the person.
And of course, it depends on the frequency. Well, first of all, it depends on the pressure
Right.
that's being used, but it also largely depends on the frequency. And going back to your research, you did 3 times a week. I do believe, correct me if I'm wrong, because people need to come for the study just to make sure that there is compliance. Is this why you did 3 times a week?
So,
Or that was one of the hypotheses?
well, I did 3 times. Almost all of my patients come 4 to 6 times a week. And I tell most people, if you're coming once or twice a week, don't come. That's my stance on most of the things that we're doing. There's exceptions to that, but that's the general guideline. I did 3 times a week in the research because that's another question I get all the time. Is 3 times enough? And what do I say? I don't know, because no one's ever done it. So, could I have done this? Could I have done a 1.3 versus 2.0 5 days a week and gotten probably stronger results in both categories? I'm quite certain that I would have. But I chose 3 days a week because, yes, compliance for the study, but mostly because I just wanted to know, like, does 3 times a week help anybody? Because people ask me that literally 10 times a day, almost 7 days a week, 365 days a year. And my answer is, I don't know. Now I can say yes. Is it as strong as 5? No. But can we at least know that we're going to make progress? In most cases, I feel strongly saying yes now. It'll take
But
longer.
it'll take longer.
It'll
Yeah,
take
I
longer,
agree.
but we'll get there.
Longer, and the sort of the increments of getting better will be slower and smaller. So if time is not of an issue and people can travel to clinic, maybe they have a hyperbaric chamber at home. Um, 3 versus 5
Yeah, I would
in
do
your
5 or 6 every time if
very
I
good.
could. Yeah.
And may I add to that, when people take breaks during the week, I always say try not to take days in a row, even if you take 2 days off. Let's say it's a Tuesday and a Friday rather than Tuesday and Wednesday, just to make sure that you can ride that wave of a previous session into your next session. That really does matter. And I think it's one of the disadvantages after all of hyperbaric therapy is that it's not a one session therapy. It needs to be.
It's not a pill. It's not a
Mm-mm.
one-time pill. But
It's absolutely not.
it's also far more impactful than any pill could possibly be, you know? So, it's a major time commitment. It's a major financial commitment, regardless of you're doing it at home or doing it in a clinic. There's pluses or minuses of both of those, but there's no way of avoiding the time commitment and the financial commitment. You just have to understand whether the time and financial commitment is worth that to you, right? Certainly, whether it's a diseased model that we're talking about or a longevity model that we're talking about, you know, the natural course of most diseases and illnesses is to get worse over time, which is only going to mean if this is going to help you, it's going to be harder to help you later. It's going to cost more to help you later, and it's going to take longer to help you later. And if we're talking about it from a longevity standpoint, aging is the number one risk factor for all chronic illnesses. And so if we want to wait until we get to that point where we have a diagnosis, so now we're going to go do something about it, we can certainly be reactive. And thank God hyperbaric helps in many of those cases. But it's going to cost more. It's going to take more time once we cross that imaginary line. If it becomes part of something somebody's doing on a regular basis, the same way you would eat well and exercise your body and, have, emotional and spiritual practices in your life to keep other areas balanced, oxygen is one of those foundational tools. This is not a fad. This is not like, it's a molecule that is required for almost every cell in your body, other than red blood cells who carry it, to function normally. And so, having this tool implanted into your lifestyle over decades is going to be what we're going to find to be the most beneficial. I'm 100% confident about that.
Hyperbaric therapy is here to stay.
Yes,
It's just started
I agree.
its journey into our lives.
Mhm.
Really, we thanks to people like Dr. Jason Saunders, we know a little more every day. Thanks to the research that's being done, and I can only imagine what goes into that research, how much work. But this is what helps us progress, as I said, as a community, because ultimately we want to live longer, but we also want to live a healthier life so we're happy and we're productive, and hyperbaric definitely helps. Jason, thank you very much for coming to the show. Now, what if people want to find your research? Is it available online yet, or it's still waiting to be officially published?
So it'll be published in pieces. So the dissertation holds 80% of the information, but even that will end up being about 3 or 4 papers. One of which was published already in the Therapeutic Sciences Journal. So that was published back in February. I have 2 others that are being finished right now and 1 more that I'm yet to do. There'll be so those will probably take another 2 months. The one yet to do will probably take another 4 to 6 months. And then, I'm sure there's still some data in there that, even, like, within those methylation panels, there are locations that were measured that we don't even understand what they mean yet. So as we identify what they mean, I'll be able to go back and be like, "Did that happen in this study? And if so, is that meaningful? And, hey, is there a paper?" So there'll be a lot to come, in the future, but, in the next 6 or 8 months, at least 2 more of those papers will be out for sure.
And once that's done, do you have any plans on future
Future
research?
research, I gotta keep asking questions.
I have
Asking
tons of
questions, try
questions.
to answer them, ask more, try to answer them.
Come to the podcast.
Yeah,
I have so many questions. Jason, thank you.
of
That
course.
was such an amazing conversation. I learned a lot. I'm sure our listeners and our viewers also learned a lot. I'll leave all the links where Jason could be found. Jason has a clinic in New Jersey. Um, Dr. Jason Saunders teaches hyperbaric courses in the US. Those are certification courses. If you're planning to use hyperbaric therapy, whether for yourself or especially in the clinic where you will be applying hyperbarics for other people, I strongly encourage you to get certified in hyperbaric therapy. I teach courses in Europe. Jason teaches courses mostly in the US. This is the best investment ever, 4 days of your life, but you will learn everything there is to learn about hyperbaric therapy because you will understand the mechanisms of action. How does it work? So, every new study that comes out, you can actually understand what research has studied and what the implications are. And to keep the industry safe, I think this education must be a prerequisite in order to use a hyperbaric chamber, whether at home or in a clinic setting.
Couldn't agree more.
The links to the courses are in the podcast description, and I'll see you next week.